love it. Listen, this audience is proof we can talk about anything on the Tamron Hall show. Nothing is off limits. So here we go. When we think about infertility, the focus is often placed on but listen to this. According to a recent study of the couples in the United States having trouble conceiving, over 50% of the time, it is because of male infertility issues. Bachelor alum Colton Underwood made headlines earlier this year for his fertility struggles, and when he welcomed his newborn son in September, it gave a lot of men hope. Well, our next guest, 37-year-old Jarrett Wright, knows the struggle all too well. He and his wife have been through what he describes as a heartbreaking 5-year journey to grow their family. Take a look.
My wife Erica and I have been together for 10 years. It was always my wife's dream to be a mom. At the beginning of our journey to grow our family, I went to get evaluated at a fertility clinic. I got diagnosed with non-obstructive azoospermia, meaning my sperm count was 0. On the drive home, I started crying because I didn't know whether I'd be able to have children. I wanted to do whatever it took for my wife and I to grow our family. So I underwent multiple procedures to extract sperm, and she underwent 3 egg retrievals. This journey has been the most heartbreaking thing my wife and I have gone through as a couple, but in the end, I know it'll all be worth it once we're holding our baby.
Please welcome Jarrett to the Tam fam. Listen, you got other guys in there saying they love you, bro. I mean, my God.
I love you too.
I love you too. I'll start with the most challenging question. It's the shame. A lot of men experience. You said it was heartbreaking for you. Help me process when you first, the doctors first told you that the challenge was you.
That was a hard pill to swallow, but the doctor came in, he had his scrub, it was one of those situations where, he had the scrubs on, he took the hat off, he said, look, this is a very severe case of male infertility and we've detected 0 sperm, and then he gave us our options, and I underwent 2 procedures, varicocelectomy.
And what is that?
I had a varicose vein in my testicle, and they had to go in and cut the vein to increase the oxygen in hopes to increase sperm production. Yeah. So after that, I underwent a micro-TESE procedure, testicular sperm extraction. I underwent 2 of those, and they took out my testicular tissue, and they did find sperm, but we were, it was very harrowing. It was very heartbreaking, to say the least.
And unexpected, because as I said, most people assume when there's a challenge, it's the woman. Emotional, mental support. What was it like for you?
Well, I had asked my urologist at the time, and I said, is there any support out there for men going through this, or black men going through this, or anything for male infertility that he knew of? And he said, I don't really know of anything. And that just roots into how much of a conversation there isn't. So, I have found through Facebook, there are male infertility support Facebook groups. I've been in touch with a lot of people. I obtained my master's in journalism. Yeah. So I did my capstone on male infertility and the stigma.
And now you are spreading the word to help other people. I love that.
Yes.
So, your wife Erica is here. She experienced the other half of the journey, 3 egg retrievals, 5 transfers that were not complete. You say it was her dream to be a mom. Now, I'm gonna take a deep breath, because Erica, you guys have wanted to share something with the Tam fam.
We are pregnant.
Congratulations. Oh my gosh. I'll give you a hug. That's the sweetest thing. I I'm so happy. I know it's still early in the journey, but please know we want every update. We are rooting for you, and you are an inspiration to so many families. And you look beautiful, glowing.
Thank you.
Give it up for Erica and Jared. We'll be right back. Welcome back. We are still having our hour-long conversation on fertility. We just celebrated it with Jared and Erica, who opened up about their expecting bundle of joy after a 5-year journey unable to conceive. Now, joining the conversation is Dr. Tamron Hall. He's a urologist and trained microsurgeon who specialized in male fertility for 14 years. He's the former president of the Florida Urological Society and currently works as a urologist for Orlando Health. Please welcome Dr. Hall to the conversation.
Thank you.
All right. Thank you. I'm going to just launch right in this one because according to a recent study, sperm counts are down 52% worldwide.
Yeah.
What is behind that?
We are seeing a decline, whether it's because of obesity and people being overweight or poor eating habits or stress or smoking or alcohol. A lot of it, I think, really comes down to poor communication. Guys just don't know that they could be a problem. Like, just look at this show. We went through half the show, and now we're talking about people like Jared.
Yeah.
Whereas we are 50% of the problem as guys. So a lot of it does come down to just not knowing that, hey, my swimmers could really be affecting this whole fertility journey.
So 2 words stuck out to me.
Yeah.
I don't like the phrase the problem.
Yeah.
It makes me sad because, I mean, our bodies, and I happen to be a person of faith and God, and it's so complicated. And then the other word, swimmers. I've never had anybody say that on my show. So
Producers said I could say that, so that's
they
why I
told
said
you
it.
right. I'm not offended. If you're lucky, they're swimming, and we're going to get right to it because you have 2 dishes representing what the average male sperm count is around 50 years ago versus today.
Yeah.
So this is what it was about 50 years ago.
Yeah, it was a lot more sperm, a lot more swimmers.
And this is what it's like
half that now.
today.
Yep.
Oh, I took them off.
Oh,
okay,
sorry.
that's okay. So that's half that now.
Yeah.
Okay, so 3 things you check for first in a man experiencing infertility. The first is how fast the sperm moves, known as motility.
Yep. So there's, when someone like Jared comes and sees me.
I feel like Jared is like, okay, I'm over here like, I'm the patient in the office.
No, but seriously, what you went through where you saw a clinical provider that just didn't know what was going on, you know, hopefully that doesn't happen to any guy in the future because most urologists should know the basics of working it up.
And this is motility.
And this is what we check for. So we check labs, we check a history, but when we actually look at the sperm under a microscope, the first thing we look for is how many there are. The second thing we look for is how well are they moving.
Right.
What kind of swimmers they are. And
That's
there's different
motility.
grades of swimmers.
There's
yes.
different grades of it. Okay. And then you look for the shape, known as morphology.
Morphology, yes.
Okay.
So sperm, just like all of us in the room, can all look like different shapes and sizes.
That is fascinating to me.
The shape is not as important. Like, you may have all these odd shapes, and they're not all a problem.
Okay.
Really, because they could still swim their way to where they need to swim to.
Right.
As long as you have a lot and you have good swimmers, the morphology is less of a problem. You only need 4% normal morphology to have a normal reproductive
So only
issue.
about 4% of what's in here needs to...
will look normal.
Okay. And then what do you look for, the third thing?
So the third thing is how many there are.
Okay,
So
count.
we're actually looking for the count. So you want millions of sperm. You want over 40% of them to actually move in the right way and be very strong swimmers. And then you want at least 4% to actually look normal. Now, there's people having tons of babies with all abnormal values. And there's people with lots of great sperm, like the perfect ideal counts, and still having difficulty with fertility. So it doesn't mean like if you have normal sperm analysis or semen analysis, it's going to translate into pregnancy because there's so many different factors. The way I like to tell my patients is, listen, you got to treat your testicles and their health and your fertility like you do your heart. Anything that's good for the heart is good for the factory down there.
Well, there you have it. Dr. Brumba, thank you so much. Thank you, Jared. Congratulations.